Hello, and welcome to this month's Simon Says. Thank you for spending part of your day with myself and my colleague Ann Cottingham. I'm Dr. Larry Cripe. I'm a professor of medicine at the IU School of Medicine and a researcher at the IU Simon Comprehensive Cancer Center. For a number of years, my collaborators and I have studied conversations between oncologists and patients. We do so because of the belief that the best care requires the best conversations. Our goal has been to identify the important topics that are often not discussed and develop digital resources to help patients, family members, friends, and members of the healthcare team to discuss these important topics. One resource is the patient goal activity, which we'll look at later if time allows. Joining me today is my collaborator of many years, Ann Cottingham, who will introduce herself and share her reflections on the importance of personal goals in cancer care. Ann?
Hi, I'm Ann Cottingham. I'm a health services researcher with Regenstrief Institute and work with the IU School of Medicine. And I have worked with Dr. Cripe, as he described, on many projects over the years. Thinking specifically about our work with personal goals, we have heard so many times from patients how important it has been in working with their oncologists to establish what their own goals were in order to identify the best treatments. In my own experience, we have had this as well. For example, my daughter was a violinist all through high school. During this time, she fell at one point and hurt her wrist very badly, the left wrist, which is the wrist that allows you to make the different notes on the strings. When it came time to do her surgery, it was interesting because it mattered that she wanted to return to the violin with that same level of fine motor coordination. And so in our discussions with the surgeon, she emphasized how important this was to her, even though it required a little bit of a different surgery that might take longer. She would be under longer. There was a trade-off there. She was definite that this is something that she wanted. And so working closely with the team, she was able to make that happen. And so they made sure that the surgery that they put in place was something that would have the greatest chance of preserving and re-establishing the level of fine motor coordination that she needed. That was not a topic they brought up. That was a topic that she brought up. I think if she had not brought that up, we may have gone ahead with whatever their usual surgery is that I'm sure was excellent. But it went a little differently because she was so concerned about this particular point. Larry, is there?
Yes. No, I was just want to make sure you were finished.
Yes.
So thank you for sharing that. And I think it's fair to say that you and I both believe that the best cancer care requires two things. One is that the oncologist, who is the expert in the information, the evidence about cancer and its treatment and care, communicates that information in a way that's useful to the patient. And we've spent a lot of time thinking about that as well. The other piece of this, though, I think is equally, if not more important, and that is that the patient has an opportunity to think about that information from their perspective. And as you know, I think there's the language for this is not great, but we'll go ahead and think about this as from the patient's goals or the patient's values and goals. And that when you have both of those pieces discussed, that the oncologist is the expert in cancer treatment, the patient is expert in what's important to them, that's what you need to have the best care. And I believe that fervently. As I think about this in this session, I realize though that one thing that surprises me is so I've been doing this for 35 years, and the treatments that we have for cancer now are just so much better than we used to have when I started training. And yet, as I think about it, patients thinking about and understanding patients' goals is still important, if not more so. And that's because each of these new options come, I pick up on a word you use, come with trade-offs. So there may be more side effects, there may be more inconvenience. And without knowing both what accepting that buys or potentially buys for you, and for the oncologist knowing what's important to you, it's really going to be hard to choose between now what is just an abundant number of options compared to what we used to have. So I guess what I'm saying is I think at one point I thought, well, maybe we'll get so good in cancer treatment that we won't need to think about goals because the goals will be so easily achieved. But I think we're still at a point where it may feel like we don't have to think about goals, but we really do, and it's probably more important than even when I started years ago. So what I'd like to do is based upon your own experience and the interviews that you've done with dozens of people with cancer or affected by cancer, caregivers, family members, and friends. Uh, why do you think these conversations about patients' personal goals don't happen more consistently? What are some of the things that you've seen that prevent that from happening?
Sure, that's a great question. Um, Oftentimes, patients have identified that they're urgently focused on getting their treatment. And so there's some kind of immediate need to identify a treatment quickly. And so in that urgency, a conversation about goals just doesn't come up. It's we need to get you into treatment right now. And it just kind of patients feel that it just happens and that there's not time to have that conversation. Other times there are patients when there's more time available who really don't want to share their goals. Their sense is the oncologist is the expert, and I just want to do whatever that oncologist recommends. Um, and these patients often don't realize the situation that you just described, that that oncologist has lots of options for treatment that could be tailored to a particular patient depending on what their goals are. But there's a fear that if they give any input, the final result will be less than if they just let the oncologist make those decisions. Some patients feel like they have discussed goals with their oncologist because they talk a lot together. They share what'd you do over the weekend, or they have a friendly banter or rapport. But in digging a little deeper, oftentimes that friendly banter has not resulted in a conversation about what is most important to the patient or what their goals are. And so that can be a little tricky or confusing when the patient feels like, that oncologist really knows them, but that oncologist does not really know their goals. And so being clear about having a conversation focused on what's really important to you is critical, or it may not happen. I think those are some of the main reasons. And then sometimes the oncologist doesn't invite that conversation. They don't ask the patient what their goals are, and the patient doesn't then feel like it's a good idea to kind of share uninvited information. So many times that is not invited by the oncologist, and the patient isn't prepared to just jump in and start talking on a different topic. So if the patient hasn't really thought beforehand, this is something that's valuable, that's important for me to share, that the oncologist really does want to hear, even if it's not invited, right? Then the patient may not be fully prepared to share their goals.
Very nice, thank you. So I'll just I'll answer that question a bit myself from the oncologist perspective. I know that as we talked about, you've interviewed lots of patients to get their perspectives. Um, I will say I was also struck as I was thinking about this session we're doing in that I think about patient goals a lot. And yet when I'm in my clinic, I still find these conversations very challenging. And I'm going to share a couple reasons why, with the goal of helping people who understand that probably their doctor is more interested in that, in their goals, and more willing than it's commonly assumed. Um, so the first thing that you said that struck me, Ann, is I think talking about goals is a fairly intimate conversation. And I think it's interesting, as you mentioned, that in a lot of our informants, people said, well, I know Dr. So-and-so pretty well. We've discussed grandchildren or we've discussed summer vacation. And that's all true. And I think that relationship is very important. But I think there's a lot of assumptions about what people's goals are, and that we shouldn't make that assumption, that we should remember that just because we share certain common things or share our experiences, that those often don't speak to our goals. So I may have visited my grandchildren recently, but that doesn't tell anybody about how important that is to me, is I guess basically what I'm saying. What do you think of that as an explanation for this sense of, well, I have discussed my goals already?
Right. I think that's very common. One of our participants explicitly described that kind of a scenario and then went on to suggest, I really wish we could talk more about goals because I feel like we are not 100% on the same page. Quality of life is very important to me, and I don't know that my oncologist knows that. And so I think that what you've just described is very much what I've heard.
Great, Dan. Another thing that you talked about, which I think is what we all deal with, and that is the focus on therapy. So I understand that, and I think absolutely think it should be, is that one of the first questions should be, what are the treatments and how might treatments make my situation better? So I think that's absolutely appropriate, and I'm not saying we shouldn't focus on that. But I do think it might be helpful for people to know that the way most oncologists, I believe, think about this is we think about what are the goals of therapy, what are the outcomes that we're really hoping for, and we call those benefits. What are the outcomes we're really hoping to avoid, and we call those side effects, complications, or harms. So the doctor, for the most part, I believe, and the nurses and pharmacists are framing it within goals. So even though we're thinking about therapy, the focus is on therapy, that therapy is really thought about in terms of what it can accomplish, what you might not, and which is very similar to goals. So I think it's almost, and then you can comment on this, it's almost sort of like the person says to the oncologist, what are your goals? And the oncologist should say to the patient, what are your goals right back, right? So it's this exchange. One is going to be more technical, the other is going to be more personal, but they're really talking about on some level the same thing. And that is, it seems to me, what do we hope for in the future?
Right, exactly. And when I've talked to patients and I ask them, tell me about your goals, every single patient is without hesitation able to share with me a variety of goals. So it's not that patients don't have the goals. I think they do have the goals. It's whether they feel comfortable sharing them within that conversation.
Great. And then a final one I'm just going to talk about from my perspective is the issue of time, right? And I believe on some level that time is underlies much of this, because if there were unending time, you could think about having these conversations, or because then you just would have plenty of time. And I'm struck by the fact that often these important conversations, including the way I do this, so shame on me, but oftentimes it's sort of at the end of an already packed meeting, and you're then sitting there thinking, well, we all share the same treatment goals, and they all seem reasonably important to the average person. It's in that effort to say, but let's talk more particularly about you. How do these things that we discussed strike you, right? To say that to the patient, which takes a lot of time. And once again, I think it feels a little more intimate than most of the things we talk about. So what do you think about, and this will take us into the next part of this is, so what patients and providers can do to have these conversations. But what do you think about this issue of time? Does it come up from the patient's perspective? What insights did you gain from that?
It's interesting. So yes, some patients definitely talk about time and a concern that if they take the time during the conversation to talk about their goals or something that they feel is a little extraneous, that they're taking away from the oncologist's time or they're taking away from the next patient's time, or the oncologist purely doesn't have the time because they're so rushed and doing all the different things that they're doing. So I think for many patients, that is an issue. For some patients, it is not. Some patients come prepared with a list of questions and a list of things they want to talk about, and time is not a concern. But many patients are concerned about there being a limited amount of space in that clinic visit with their oncologist.
That's really interesting that you mentioned the list of questions. And so the next part of this is going to be sort of our reflections on what might people do to make it more likely that their goals are thought about or talked about. Um, but I'm intrigued. Tell me a little bit about your thoughts about how preparing questions, which seems a little less value laden and intimate than making a list of your goals. Expand a little bit about how the question and communication of personal values and goals might work together.
Sure. So some of the patients explicitly talked about concerns that they had potentially with a treatment and of coming into that visit with those questions. For example, one woman mentioned that knitting is a very important part of her life, and she knows neuropathy can be a side effect of some of the treatments. And so she wanted to know, will these treatments affect my ability to continue to do this important hobby? Are there treatments that would impact this ability? Many of the patients talk about kind of really trying to do their own research about possible treatments and how those might affect their quality of life, because the way those treatments impact their quality of life was important to them. You know, knowing that many may impact their quality of life in some way, different treatments may do it in different ways. And so trying to come prepared with those kinds of questions to make sure that they understand and that their oncologist realizes what is important to them in those in their lives that may impact the kind of treatment that would be the best choice.
Yeah, that's really interesting. Thanks for that, Ann. I think that feels like a slightly less threatening way. Because I know for me, I don't know about for you or other people, but for me, if someone says to me, what are you doing or what will you do? That's a lot easier to answer than if someone says, what are your goals? I mean, it just feels like goals are just one layer deeper and more gets to your motivation and and I just think that's, but the idea of thinking about um, asking questions about how will um, treatment, if that's what's being discussed, or how will observation change the things that are important to a person. I really like that. Yeah, great. Thank you for that answer. Um, we don't script these things, so I just want to share with the audience that one of the things I love about this is that I always learn something from Ann when I talk to her. Um, So, and I'm going to stick with this question of what can we do. I'm going to break it up a little bit though, and you may not agree with that, but I believe part of the challenge is thinking about goals, right? Is and then the second challenge is once I've thought about the goals, um, how do I share those goals with somebody, right? And then third is what happens to how do I think about my goals once I've said them aloud to somebody with whom I'm in this relationship around this experience of cancer? Um, so is that fair way to proceed? How do I think about it? How do I communicate it?
Yeah,
Um, and of course, a lot of what we're doing, and hopefully what we're going to show people is strike them, is we thought about how do you help people think about goals. But what would you say to a person who says, I have so many things to think about. I just don't have time or energy or inclination to think about my goals.
right. Right. So many patients initially in our conversations didn't think about their goals or express the same sentiment you just shared. I just, of all the things I am doing now, I don't have time to think about that. But in further conversation, realizing that thinking about goals is very important in terms of thinking about your treatment and your future. And so identifying goals could influence what is the best treatment for the patient, right? As we talked with patients about that, they would begin to note that, right, this could influence my treatment. So it's an important thing to do. Many patients also mentioned that sometimes the oncologist thought they knew what the patient's goals were, and you kind of alluded to this earlier, but they were wrong. So sometimes, for example, the oncologist would want to continue with a treatment that was, extending life at all costs, whereas the patient was feeling like, you know what, I'm good now. Quality of life's important to me. I don't share that same goal, but it had never been discussed, and so they weren't on the same page with where they wanted to go at that time. Um, some patients have discussed their goals and identified how these positively impacted decisions, that treatments were identified that allowed them to continue to do the things they wanted to do. For example, that would allow them to continue volunteering or continue to join celebratory family events, even if their life may not have been extended as long as possible. And it was also interesting that many of the patients, nearly half that reported they had not discussed their goals, reported similarly that they had concerns about their future. Whereas all of the patients who reported having discussed their goals also felt much more confident about their future, because they had a sense that they were on the same page with the oncologist, and where things were going to proceed was more in line with what they wanted to have happen. So discussing goals, identifying goals seem to be really critically important with the patient's experience of illness.
Thank you, Ann. Those are great thoughts. I think I'm going to go back. I'm stuck on this time. I'm going to go back to the idea, though. I think that first, what I would say is, first of all, if it's difficult for you to think about goals, I would say, of course it is. Because I think so often in everything we do in life, we're so interested in doing and getting things done that we may not be as aware. So I don't think it's something we necessarily practice in life in general. Um, Secondly, I would say I suspect um, there every oncologist, if somebody said to them, I would like to talk about my goals, would figure out how to make time. Maybe the first pass would be meet with the social worker or the nurse coordinator or another visit where that can happen. Because I think especially as people live with cancer and require multiple treatments, the oncologist is thinking about the goals. And so I'm going to try to reduce the burden of thinking about goals before talking about them, Because maybe the conversation can be, I'd like to talk about my goals. Okay, great. Let's talk about them. What are they? And then to say, well, I don't know. That's why I'd like to chat about them. And once again, I think the oncologist would be fairly fluent in at least talking about the professional goals, right? Or even say to the oncologist, well, what do you think my goals are? As you've been planning things, what are the assumptions in your mind? Um, so how about that idea? It's just even
Mhm.
if you just knowing that maybe they're important, just saying, I believe we should be talking about my goals right now. You think that would fly?
Absolutely. I think that would be very welcomed. And I think I love your question. What do you think my goals are? Because in planning treatment, the oncologist has ideas in their head, as you said, and I think that'd be very helpful for the patient to hear. And then the patient can either agree or disagree, and that could be a nice way to start the conversation.
Yeah, I think so too. And I think that then I guess the last thing I'd say is, um, because I'm a very scripted person, wanting to plot out, but just go with it. Just go with the idea that things will emerge that you hadn't thought about, right? I mean, I don't know. I think that if someone asked me once again my goals and I started talking about them and they knew something I didn't know, like, um, whatever, that hearing that might make me say, okay, well, maybe I need to reappraise this, rethink these things. All right. Well, and I'm going to move us to show a quick demonstration of the goal activity which
Mhm.
we have developed. Um, do you have anything you want to say before we do that?
No, let's dive in.
Okay. All right. So I am going to share screen for the audience there. Um, and I'm going to show you something that we developed that people can use at home. I'm going to show you the patient version and that will show you how this works. So the first thing I want to say is that some of the statements are going to be um, about very serious matters, that are relevant to the end of life. And those statements are in there because often as people live with cancer for a number of years and treatments become less effective, those kind of questions are very important. So let me share screen. And then, so the idea is to read a statement, to think about this, and this can be done with a caregiver. The personal caregiver can do their own set of cards, and then register how much you agree or disagree. Um, and I'm not going to go through all of these, um, but what I'll show you in a minute is this idea that there's a lot of different goals that are directly relevant to treatment decision making and communication about the goals of treatment um, and thinking about uh, the end of life. And if a statement is not relevant to you, you can skip it. Um, so here's another communication goal. Um, and then more personal goals about daily routines and responsibilities. Um, so at a certain point, the person can complete these, and then this generates a summary. Um, because I've just done it once and I haven't done all do you see the summary and did it shift?
Yes. Yes.
I haven't done all the questions, I've only done it once. You can see that basically there are some goals that are relevant to the treatment decisions, end of life decisions, communication preferences, and then your personal values. And the idea is that a person could access this multiple times and that we would keep track of whether there was any change in their goals and how where their goals are leading in terms of treatment decision making and options. And that would be shared with the oncologists. So my understanding is that we will send out to participants the link to this. And this is something that's available 24/7 that can be used by anybody. And we did share this with a fair number of people who had cancer and some of their caregivers. Do you want to just talk a little bit about what people's reactions were to this?
Sure. So first, the patients really appreciated being able to think about their goals and to record their goals by moving the slider bar. Many of the patients were not at an end of life stage. Some were not. And so some of the questions initially caught them off guard, but then they were extremely happy that they had an opportunity to think through some of the more difficult aspects of their care that oftentimes they had not considered yet. And even identifying their goals related to some of those end of life issues helped them think about their more immediate goals in view of those potential longer term situations. So this was very well received. Patients appreciated it, and they appreciated having that opportunity to share this with their oncologist during their visits. I think it was a nice and easy way to kind of summarize what they were thinking, and it could initiate, they felt, important conversations with their oncologist.
Thanks, Ann. Yeah, I'll just follow up on one of the points you made, and I'm sure you've heard me say this in the conversation. I think I have yet to say to somebody, we should talk about what might happen if treatment doesn't help you, or we may be at a point where treatment's not necessarily the right answer, where somebody hasn't said, I've wondered when we were going to talk about this. So I think it's about, and as you know, we were a little concerned about, we thought, well, do we have a set of goals for people early in their course and not expose people to these kind of questions? Or do we have a single deck like we decided to go with? And I think it just continues to amaze me how often, amaze is not the right word, but how surprising it is that these topics, people say, yeah, I don't want to think about it, but I have thought about it. And I was wondering when you, meaning the oncologist, or me, the oncologist, were going to mention it. So I do think that using, and if you don't want to think about it, you can always skip it, but it's out there, and I think we all know that it's out there. That's great. I want to keep us on time. So we actually had a lot of questions submitted, which we appreciate very much. And so for the next 6 minutes or so, we're going to talk about questions. And then the final question, we're going to take a little more time on because it's a little more expansive. But let's use this. So one of the questions is, what are the common barriers patients face when trying to talk about what matters most to them with their medical treatment? So do you want to list 2 or 3 barriers, Ann, that strike you as most salient, and then perhaps give a sense of how you might make that barrier an opportunity for discussion?
Sure. So I think one of those barriers we've already talked about, and it's time. Patients are concerned about bringing up their goals because they're not sure there's time in the appointment. But I think making that into an opportunity, now that we've had this initial part of our discussion, it's clear how important those are to the oncologist, to help the oncologist identify the appropriate treatment. And so it's not a waste of time. It's not a misuse of time. It's a really important use of your time to ensure that your oncologist is aware of what your goals are.
Great. You know what, Ann, let me do it this way. You go ahead, listen, and give it your solution. I'm going just, then I'll add on to you. Here's the thought I had while you were talking about is bring a piece of paper. I think when I walk in a room and if somebody has a piece of paper, my natural curiosity is what's on that piece of paper, even if it's small, small notepad or a large piece. And even if it's just single words, like you could just have goals, the word future. And the oncologist will, or the nurse or the social worker will be able to. So I don't think it has to be burdensome, but I do think bringing something in to say, this is what I would like to happen, maybe
Mhm.
perhaps if we can, would be very useful and very time saving. But
Mhm.
what's it?
Mhm. And so I think another concern that patients had was that sharing anything on their side might detract the oncologist from making like the best possible treatment decision. There is a desire that, the oncologist is the expert. They need to make a decision about what treatment I should have. If I share any thoughts about that, we may be wrongly directed. Um, and so I think really, as we've been talking about it, the flip is the reverse. So the more information that oncologist has about what is important to you in your life, um, that will help the oncologist select among the many treatments that are now available to identify which ones will really serve your purpose best. So instead of misdirecting the oncologist, it importantly directs the oncologist to what will work the best for you.
Thank you. So two questions are very similar. One is how can I balance my personal goals with the recommendations of my care team? And what should a patient do if their goals conflict with the standard treatment recommendations? So I'll start out with that one. I think hopefully you're not seeing a recommendation that um, isn't consistent with your personal goals. Um, I think you can always ask, if you're not sure about it, you can always ask about, well, how will this help me in terms of what's important to me? Or how well do people do with this? But I don't think, or another, maybe an easier question is, how was your treatment recommendation and how did my goals influence your treatment recommendations? That would catch your doctor's attention or your nurse's attention because that would remind everybody that that needed to be thought about. What do you think, Ann?
Yeah, that's a very important point for just the reason that you described. I think that's something that they mean to do, but being busy sometimes that may have slipped their mind, or that they may have been very excited about a new treatment and bringing them back. Will this accomplish my goals as well? I think is a nice way to further that conversation.
The other way to think about it is to ask the oncologist is how standard or how easy was it to recommend this treatment? Because I think there are more and more situations where treatments are well tolerated, effective, and in which case it may be that the treatment goals really should dominate things. Um, so another question is how can caregivers or family members help patients reach their goals? Um, I think that patients and family caregivers can, first of all, remember to ask the question, well, how will this affect what's important to you? And also practice with each other before the meeting to talk about. And finally, for me anyway, I think oftentimes it's the caregiver, the family or friend in the room who will say, wait a minute, slow down. This is all nice, but I happen to know this about my friend or my wife. And I'd like to make sure you know that. So being the person who says, slow down, let's make sure we've covered all the things we need to talk about.
Right. I heard that many times. The caregiver had a close relationship with the patient and was very familiar with the patient's goals and was often the one to stand up during the appointments. and reiterate how will this accomplish the goals in a nice way. And the patient appreciated that.
Okay, and then a quick question is, can statements be changed to reflect different patient populations? Yes, we absolutely are open to collaborating with people or even letting people change them and share with the changes they wanted. The final question, which is not just about goals, but I think really a great question, and that is, and we'll spend the last 3 or 4 minutes on this, Ann. What are the top 3 questions a patient should make sure are answered in the first appointment when a cancer diagnosis is confirmed? And then how do these questions differ from a caregiver should ask? Well, let's just go back and why don't you list one, I'll list one. If we can't come up with 3.
Right. Well, I think a good question is, given my condition, what is your goal for my therapy at this point? To be exactly a question you brought up earlier, Dr. Cripe, understanding what the oncologist is thinking and kind of what direction they're taking with you with the therapy choice.
I think I would agree. I like that. I like that thing about the way you phrased it the second time. What are you thinking, right? And then if you don't hear the doctor thinking about your goals, perhaps that's the time to say, well, can we add to this mix? Because often, honestly, we're thinking very technical information but to say, what are you thinking? How are you thinking about me? And if you don't hear, well, I'm thinking about your goals as well, then that may be where, and probably the caregiver is a person to say, well, what about my wife's goals? Um, I think a question I also think is quite useful, and your oncologist will have thought about this, and that is, do we have all the information we need to select, to understand what my future is likely to be, and to make the best decision for me? And once again, I think that that might uncover the fact that, well, it's not just the evidence, the path report, but it's also the goals of the person. So that would be, do we have all the information? How about another one, Ann?
So what should I expect in the near future and then in the longer term? In terms of the progression of my disease, in terms of my response to therapy, what should I be expecting?
Yeah, I love that question as well. And I'm just going, and then you can do this too, because you've interviewed a lot of caregivers. Um, I think even when the caregiver doesn't seem to participate much in the conversation, the fact that you're in the room is influencing the conversation. So I would say to the caregiver, don't feel you need to say something, but the fact that you're in the room, in my experience, means that things are being said differently. Because the oncologist or nurse is now talking to 2 people and is monitoring 2 people's understanding. Um, I do think it's also, though, not needing the answers, but potentially pointing out what questions haven't been asked, right? Well, I haven't heard you ask my friend about what's important to her in the next 6 to 12 months. You've described the treatment course, but I haven't heard you ask anything like that. Would it matter if she was planning to go to Europe or wanted had a 50th wedding anniversary? So I think asking about the questions like, if you knew this, would it change what you just told us? So I think caregivers especially can be very important in correcting any gaps in conversation.
I agree. And I think the patient really appreciates that. And it can be a fine line. Obviously, the caregiver wants to support the patient and enable the patient to speak for themselves as much as possible. But the caregiver is critical for helping to fill in the gaps and further ask or identify information that the patient may not have.
All right. Well, I think we're at the end of our time. And as always, it's great talking to you, and thank you for taking the time and effort to do this. And to people participating, thank you for joining us for this month's Simon Says. You can find a recording of this session and information about upcoming sessions at cancer.iu.edu/Simon Says. Thank you and have a great day.